Um, we're going to move on to something a little bit different. It's really exciting for me to think about things in new ways and to learn to stretch my mind outside of my regular in the box thinking. Um, Design thinking is really a nonlinear process that allows teams to understand users. It challenges their assumptions, it redefines problems, and it creates innovative solutions that we can then validate. There's no other healthcare vertical that I can think of that is more suited to this project than women's health, given the multiple complexities and challenges that we face. So it now gives me great pleasure to hand over to the team of innovation experts, Michal, Shalem, and Michal, Lebenthal, and Andreson, who are filled with energy and excitement to share how we may think of solutions through a new lens. It's time to welcome our two co-founders of Impact.51 and to entice each one of us to find the problem solver and entrepreneur within ourselves. Over to you, Michal and Michal.
Thank you, Ronell. I'll just share my screen as well. Just 1 second. Okay. So hello, everyone. Michal, Shalem, and I, Michal, Lebenthal, Andreson, are very excited to share design thinking meets innovation in women's health with you today. And thanks, NogaFem, for this opportunity. What is design thinking? Well, it's an iterative process in which you seek to understand your users, challenge assumptions, redefine problems, and create innovative solutions. The method was born out of the way designers think and work through skills of matching human needs with relevant solutions. But I think rather than talking about it, the best way is to show you an example. Let's learn about the life-saving dot.
Millions of women across rural India suffer from breast cancer, fibrocystic breast disease, and complications during pregnancy. Most of these cases are linked to an iodine deficiency. Supplements in the form of pills already exist, but women weren't in the habit of consuming them. So how do you give these women the required dosage of iodine? Almost every Indian woman wears a bindi, a traditional symbol of beauty. But what if these tiny little dots could do more? What if they could save lives? Talwar Bindis, in association with Neil Vasant Medical Foundation and Research Center, introduced the life-saving dot, Jeevan Bindi, an idea that transformed bindis into iodine patches. Every woman requires between 150 to 220 micrograms of iodine daily. During the course of the day, these bindis dispense that amount to the wearer. Specially created, these life-saving dots were distributed to women across rural India via health camps and clinics. In a nation of 500 million women, these tiny little dots were no longer just a symbol of beauty. They now spelt the difference between life and death.
This iodine patch, worn like a bindi, the decorative dots many Indian women wear on their foreheads. It dispenses the recommended daily dose.
So just imagine a way of looking for solutions that begins with a deep understanding of the problem. This life-saving dot gives us a lot of inspiration about looking for a contextual solution, relevant and tailor-made to the needs of the local women. They probably asked, how might we improve women's health outcomes in rural India? Paying attention to the local context. So just a moment, sorry. So the first stage, and design thinking is a nonlinear process. The first stage that we always look at is empathizing. It's all about people, solving problems for real people, and solutionizing, as we say, begins with empathy. Empathy is the capacity to step into other people's shoes, to understand their lives, and start to solve problems from their perspectives. Human-centered design is premised on empathy, on the idea that the people you're designing for are your roadmap to innovative solutions. Well, when we innovate with women-centered design in mind, it calls for products and services to be designed for, with, and by women, based on the real pain points they experience in daily life. And if we think back to what Professor Jenkins said, well, we don't have time to waste, so we have to make sure we're as accurate as possible. I really love this quote by Harper Lee in To Kill a Mockingbird. Well, Harper Lee says, Scout says to her, well, actually his father says to Scout, you never really understand a person until you consider things from his point of view, until you climb inside of his skin and walk around in it. And that's really the crux of empathy.
Well, thank you, Michal. The next stage, after we have understood the people that we are designing for, the people that we are trying to ask the question about, is defining the actual challenge at the end. The art of asking the right question is key factor to what the results are going to be. So normally it framed in how might we, after we have done a lot of research, we have empathized, we have seen what there is to see in the field. We can now start asking questions, and the questions will be the basis for ideation later on. It will be formulating the problems that we want to solve. So how might we do something that is action for stakeholders, for women in this case, in order to make significant change? In the case of the Jivan Bindi, for example, how might we provide women in rural India with sufficient iodine in order to promote better health outcome? Or, for example, in Impact.51 that you've just heard of, our first challenge deals with menopause. And how might we question can be, for example, how might we create doctors' awareness to the signs of menopause in order to promote quality of life and better health outcomes for women? The next stage is actually what we do. We take insights and frame questions. And oftentimes in framing the questions, we can also determine a little bit of the answer or the directions we are looking for. We should also note that this stage is also just like the empathy stage. This stage is also very iterative, and sometimes in asking the questions, we realize data and things that are missing, and we need to go back and get more information on. So each stage is not linear, and we can go back and forth. So as we said, one example is how might we provide women in India with sufficient iodine in order to promote better health outcomes. And then the next stage is well after we really define the problem well, and we have researched it well, and we are ready to ideate. In the ideation phase, we come up with solutions. Not one solution, but many. We try to imagine, conceive, create many, many ideas. Buckminster Fuller said, there is nothing in a caterpillar that tells you it is going to be a butterfly. So actually, we start off with one thing, with one question, and the opportunities are actually endless. When we ask, how can women get more iodine? Some of the obvious answers would be through pills, would be in a different ways, but taking slow releasing stickers is something that wouldn't necessarily come to mind right away. And the idea in ideation is to open up to as many ideas as possible. There are no right or wrong ideas. To get one good idea, we have to put as many ideas as possible on the table without judgment. There are lots of examples that we can see when design thinking comes into play in order to create different solutions. Some in medicine, some not. Some really notable solution are like the example of IDO MRI, which workers at IDO noticed that children are very apprehensive about the MRI testing. I'm also apprehensive about MRI, so imagine kids. And this is a very well-known design thinking example. It's not only woman-focused, but it is an interesting one to see. They try to think holistically about how children experience the interacted with technology. The designers followed the children through and saw where the pain points were and helped to transform the MRI into a pirate ship, not less than that, a pirate ship. A kid's adventure story with the patient in a starring role, making no changes to the complex technology inside the scanner. They also created a script for the machine operator so they could lead their young patient through the adventure, helping create a very positive experience going through the MRI, making it much easier. And then by doing that, not having to put the children to sleep, where period to that, they were under sedation. This is almost a magic. Another good example, which is also a culture and a context oriented, is helping tackle culture issues like breast cancer in women's in countries where it's a taboo to discuss or to do tests physically in different cases. The bread exam, which came out 3 years ago in Lebanon and Syria, what actually they did, they made a short film about baking a bread and exemplified by baking bread the way that women can self-check themselves at home to see whether she has indicators for breast cancer. The big problem in those countries was that women arrived at treatment centers having been already with full-fledged cancer, so that needed to be solution, and the solution wasn't one to be bring them to the clinic at this stage. So the bread exam has saved many, many lives in Syria and Lebanon. There are so many other examples, and because of the time limit, we'll skip them, but we'll be happy to send you later on. By integrating what is desirable from a human point of view with what is technologically feasible and economically viable, designers have been able to create the products we enjoy today. Design thinking takes the next step, which is to put these tools into the hands of people who may have never thought of themselves as designers and apply them to a vastly greater range of problems.
So the next step after we've defined and designed is prototyping, building a simple model that we can test fast and iterate. And that's the prototype. After that, we test. We talk about showing, not telling. Let your users experience it, watch the reactions, learn and tweak. That's the design thinking process. Using a women-centered design approach to innovation and investment has substantial economic and social benefits for innovators, investors, and the users themselves. It also reduces the risks associated with gender-neutral design, which can result in less effective or even dangerous products for women. But understanding how sex and gender play out in the design of products and in the building of a business can have very real impacts on their success and profitability. Women's bodies necessitate gender-specific innovation that responds to their biological realities. Take, for example, seatbelts. They don't take into consideration women's physique, and they result in unnecessary serious injury. In the case of hip replacement therapy in the past, there were terrible incidences of malfitted replacements which were recalled because they weren't fitted to women's bodies. The same story is with pills, which are distributed different. There's a difference in dosage, which could be relevant due to gender differences. And these things need to be taken into account. All of these are a small sample of examples where human-centered design could actually be a game changer in relevant solutions.
As Michal just mentioned, these are only some of the long list of pressing problems in women's health. So as Impact.51, we see and identifying many pressing problems in women's health, just like those we just delineated. So we created a company to solve them. We are 4 female founders. We bring proven startup studio model to the women's health sector. For the first time, working on need-matched innovation and solutionized from scratch to scale.
So the challenge of what we do is we identify the needs, just like we've shown you in this design thinking process. We curate teams to work on those challenges, working from problem-led innovation. Then we ideate solutions, and the best teams are selected and move into a foundry. Who's on board? Industry experts, entrepreneurs, HMOs, investors, women health experts, hospitals, innovation, and most importantly, the women themselves. And we work in Israel and internationally, both in Israel and internationally. And we're happy to be in touch with any questions that you may have. And we'd love to innovate together with you. You're welcome to reach out to us. So thank you for this opportunity. Nogafem, oops, sorry, stop share.
Thank you. Impact.51, Michal and Michal. Really exciting to open our eyes to the whole new world of design thinking in women's health. And I can't wait to see the potential and the possibilities that we can co-develop together with our amazing audience and ecosystem that is with us today.